This is the ARTvocates podcast, brought to you by Streets Projects Foundation, Enugu Youth Entrepreneurship Network, supported by Voice Global.
This is the ARTvocates podcast.
Hey there, welcome to yet another interesting episode of the ARTvocates podcast. And I'm your favorite host, Zakari Emmanuel Mekalma, but as usual, you know my friends call me 2PLIE to the S, to play Zakari. And I'm a spoken word artist, a poet and a writer, advocate for the girl child, brand influencer, aside other things I do on the flip side. But you know, as usual, I don't do this alone. I've got the most delightful and amazing co-host in the building, Andrew.
Oh my God, you flatter me too much. Welcome to the show. My name is Andrea Tohe, and of course, I'm the co-host of this podcast, the ARTvocates podcast, for this episode. And as always, the show is brought to you by the Streets Projects Foundation and Enugu Youth Entrepreneurship Network, and also supported by Voice. This is where we talk about a lot of topical issues that concerns you, concerns me, your brother, your sister, your mother. So please make sure they listen to this. Over to you, Zachary.
Interesting. From your voice and everything, I feel twice as happy, you know.
Oh, I'm glad.
Interesting. Today we've got some amazing guests in the house, and they will be talking about the poor healthcare and infrastructure in our country, Nigeria. I think I'll rather let them introduce themselves. I think in no particular order.
Okay, hey guys, what's up? My name is Ehireme Austin Ramosele Ohihe. You can call me Romo Bars on it. I'm a rapper, music producer, amongst other things.
Good day, people. My name is Benga Alonge. I'm a creative advocate, a painter, a sculptor, and a pencil artist. I'm glad to be here.
Wow.
Please, when are you going to paint me? I can't wait.
One free work, I'll be.
Yeah, hello, beautiful people. My name is Nweke Fine Emmanuel, a visually impaired but vision-oriented. I'm a writer, a public speaker. Can call me a man with vision, but no sight.
Wow.
Vision writer.
Wow.
I love it.
So powerful. I can't wait to get into it. Andrea, I don't know, would you want to roll in the first set of questions? Rather?
Okay, sure. So today we're talking about the poor healthcare infrastructure in our country, Nigeria. Now we see that when you go to hospitals, there's a lot of crowd. There's a large crowd, a huge crowd waiting to be attended to. And I think this COVID-19 period, the pandemic last year and even running up to this time, we see that there's a lot of loopholes in the healthcare system.
Yeah.
So I don't know. Let me start with Rema Bars, the one with the bars. What do you think about COVID-19 and the healthcare system exposure?
Okay, we all know that the COVID hit in 2019.
Yeah.
Yeah, and
2019
actually, but
late 2019.
Late 2019, yeah, but you know, February 27th, 2020, that was when we recorded our first outbreak in Lagos. You get that right? So, quickly, I'll just say that the National Primary Healthcare Development Agency, they were, in as much as COVID hit us unexpectedly, yeah, they were able to quickly set up structures which helped to manage the situation, right? So, like structures in terms of the emergency operation centers, the data collectors, the laboratory scientists who were responsible for tracking the spread of the disease amongst the community level and everything, you know. So, in as much as we have a poor healthcare system in Nigeria, but I'm going to commend the National Primary Healthcare Development Agency because they were proactive in setting up these structures to manage the spread of COVID-19. Yeah.
Wow, I've been noticing Mr. Ifeanyi looking at me. I guess he has a contrary opinion to yours.
Okay, so regards to the issue my friend actually raised here. Now, the aspect of this COVID-19, you know, if in the local parlance, they will tell you Fawonya don't open. As it is, because our healthcare facilities, they are very poor. Even going down to the rural setting, you notice the decay of infrastructure is nothing to write home about. Because I would say it's so crazy when you see our politicians going over there for medical tourism, whereas we don't have anything to write home about. So because, you know, when the pandemic actually started, I guess in China, they built a reasonable hospital within how many days? But here we have nothing to show. The ones who have our hand is nothing to write home about as well too. So but as it it is at the moment now, we don't have any good health infrastructure here in Nigeria.
I'm mostly concerned because it seems so far the conversation has been driven towards COVID-19, but before COVID-19, we know the healthcare system. And we know the infrastructural system we have in the country, it's deteriorating. Like you go to a general hospital and you can't get as simple as syringe, you can't get as simple as injections, you can't get as simple.
Go and come back tomorrow.
You have
There's
to
no
go and buy
syringe.
from outside.
Yeah.
Like, what do you think is the problem? Do you think is the national allocation to the healthcare, or do you think our leaders or we as a people are ignorant to the whole thing? I don't know.
Yeah, the Nigerian public healthcare sector have not really been performing well. Here is a proof that they have not been doing well in delivering services. Okay, in 2017, WHO's Joint External Evaluation Program, which is the JEE, conducted a collaborative multisectoral effort to access a country's capacity to tackle diseases in the country, and Nigeria performed woefully. I'm sorry to say that. Wow. It's so bad because Nigeria, with its average of 1.9 among 15 countries, Nigeria got 1.9 as an average, and this shows that there is a limited capacity to which disease can be controlled in the public sector of Nigeria.
That's crazy.
Really, really, you see.
But let's move on to maternal deaths on the rise in Nigeria. Now, we see of recent a lot of people who are capable, couples, celebrities, people who are influenced, so to speak, they tend to go abroad to go and give birth to their children. In most cases, or should I say some cases, it's not really about the green card. Okay, yes, they want to give their child citizenship in another country, but some of them do not actually believe the medical system here in Nigeria. That's why they tend to take their kids or their wives abroad, to go and give birth, because they've heard of a lot of maternal death. So I don't know.
Now you say if you go like one born your children for this.
My dad. Let me not say it. Remember, what do you think? Would you like to take your wife abroad to go and give birth because of the medical system here?
Well, definitely, I would love to take her out of the country because, okay, I'm not trying to take us back, and let it not seem like I'm contradicting myself, being that question we asked earlier, I answered earlier, it was geared towards the COVID-19.
Yeah,
but if I'm to buttress what my guy Benga said here, according to findings here, using healthcare access and quality as a criteria for ranking healthcare system performance, Nigeria has been placed at 142 out of 195 countries. And also, Nigeria has been ranked poorly based on the World Bank's Universal Health Coverage Service Index.
There we have the numbers.
It's pretty sad.
Okay, so back to the maternal death rise.
Yeah.
So you would like to take your wife abroad to give birth. Is it because of the citizenship, or is it because of the healthcare system here in Nigeria? You don't trust it?
Well, both. Citizenship, one, but the healthcare
is number two.
Well, definitely the healthcare in the country is pretty poor. Yeah, and I wouldn't want to, put my child's life at risk due to the negligence of the government.
And that leads me to a tweet I saw sometime that I think it was some friend of mine that tweeted it. She said, if you're in Canada and you see a taxi driver, if the taxi driver is a black man, just know the black man is a Nigerian doctor that left Nigeria to become a taxi driver in Canada.
Wow.
And I was like, whoa. So now that leads me to the jackpot thing.
Okay.
Because I see so many doctors and nurses leaving Nigeria for greener pastures because apparently you see doctors going on strike, no pay and everything. Yep. Imagine studying for 7 years, they no great pay me. So Mr. Ifeanyi Nweke, what do you think? Because to me, I feel if I were in their situation or shoes, I would rather jackpot as well too. So what do you think?
Stay and go on strike.
Yeah. It's obvious that no one sees where you'll be celebrated and it went where you'll be mourned. Because as it is at the moment, the hospital is actually on the bad side. However, the government in power, they're not actually doing much in terms of the health system, in terms of the medical welfare. That's why I keep on seeing this strike occurring over and over again. Because if there is priority to health, definitely they will look into it critically. But basically, as I said, because they have these medical allowances, any little thing, they jackpot for their medical health. But I wish all of us are stuck in here to get our health care facility within the country here. Definitely all of us should look down into this health care issue. But for the poor people who have another place to go, but what's the health care facility we have here?
And pray to God as well.
Now, here we did. We're not going anywhere. Anyway, so stay tuned. We have to go on a musical break and we'll be back shortly. Please don't forget to share this podcast to your friends, your family members. Make sure they listen to this. We'll be back.
Baby, 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 baby. Make I love you, baby. I know go break your heart. You've captured my heart. I'm loving you more. Girl, I love you to the end of the world. You've captured my heart. I'm loving you more. Girl, I love you to the end. You've captured my heart. I'm loving you more. Girl, I love you to the end of the world. You've captured my heart. I'm loving you more. Girl, I love you to the end. Let me love you more. No matter what they say, I will love you more. I will love you more. Let me love you more. No matter what they say, I will love you more. I will love you more. Girl, I don't need for the la 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 with you. Oh, girl, I don't need for the la 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 with you. Yeah, girl, I don't need for the la 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 with you. Yeah, girl, I don't need for the la 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 with you. Make I love you, baby. I no go break your heart. Make I love you, baby. I no go break your heart. I don't say, oh, can you know that they fight us? Can you know that they fight us? Can you know that just want to sabotage? Tear our matter all apart. I don't say, oh, can you know that they fight us? But your love just a hold us. Then I no go ever leave your side. Let me love you more. No matter what they say, I will love you more. I will love you more. Let me love you more. No matter what they say, I will love you more. I will love you more. Girl, I don't live for me. La 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 with you. Hey, girl, I don't live for me. La 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 with you. Hey, girl, I don't live for me. La 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 with you. Hey, girl, I don't live for the la 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 with you. Hey, girl, I don't live for the la 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 with you. Hey, girl, I don't live for the la 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 with you. Hey, girl, I don't live for the la la la. La with you.
You are listening to the ARTvocates podcast.
Welcome back. Now, we're talking about poor healthcare system in Nigeria. And I think, where did we stop, Zachary? We were talking about doctors on strike. Either striking or leaving the country.
Jackpine.
Which one favors you the
Or
most?
jackparization.
You know.
Now, that leads me to asking, how does this really affect the youth of our country? Because I see that there are people who are aspiring to be doctors. There are people who are aspiring to be nurses. There are people who are aspiring to be med lab scientists. How does the situation in Nigeria now in the healthcare system affect them? I think over to you.
I think before our guest talk about this, I have a friend. When she was in Nigeria, she studied English and linguistics.
Okay.
But she traveled to the UK after her graduation, and upon traveling, she started a career in nursing. And from one of our conversations, I remember vividly, she was breaking down for me what nurses are being paid in the UK and how they are being revered, how nurses are seen as kings and queens. And she made me feel like, was my 4 years studying sociology a waste? But I think we'll reconvene on that.
Yeah, I can totally relate with you, because I also have a friend who currently she's a medical doctor. Okay. She studied medicine abroad, and her parents are telling her, come back now, come and practice in Nigeria. She's like, for what? For me? Now I'm not coming back. So I don't know. What do you think about this, Tiffany?
Yeah, truly speaking, it's actually demoralizing, because having that ambition, either from a child, you want to be a medical doctor, you want to be close to a patient, you want to treat life. Now, after spending 7 whole years in the university, you don't have a good facility, you don't have good equipment to actually save life. Because this medical person, they swore an oath to save life. But whereby they don't have the facility, they don't have the enabling environment to save life, what else do they do?
That is a big question.
Very big question.
I mean, if I'm to add to that, it still brings us back to the Japa situation, in the sense that, if we're to liken it to youths who are pursuing the medical career, right? Check them now. The system in Nigeria is messed up. We're all talking about friends, right? I have a friend who is a doctor already, and I think some weeks ago, I saw his picture actually, because this guy, since when I got to know him last year actually, and he always complained about how he's not being paid enough. He's a doctor.
Wow.
But he kept on complaining. And I always heard him say, man, only if I could leave this country, this country. Just to check his status a few weeks ago. My guy don't do Yankee like this. I'm telling you. Straight up. You get that? So
wings.
Movement.
Honestly, I hope we don't run out of doctors and nurses.
Exactly. That's the thing. So,
at the rate it's going.
So youths who are pursuing the medical career, trust me, they don't want to practice here in Nigeria. They just want to leave. So, that's as a result of the poor healthcare system in Nigeria. So that's the reason.
Where does that leave us if everybody wants to leave?
Exactly.
We need solutions to this.
Because we need solutions
to this. So, I don't know, Benga, what do you think? What are the possible solutions to this? Because we cannot possibly not have doctors and nurses in our country because our healthcare infrastructure is deteriorating.
Yes, our healthcare sector should improve collection and monitoring of health data, improve personal developments in the healthcare, ensure the provision and availability of essential drugs availability. I think those are the basic.
Yeah, possible solutions to the healthcare system in Nigeria. I believe health workers, as we know, doctors, nurses, they should be given more incentives as a kind of gesture, or rather as a kind gesture to further motivate them to do what they already love to do, which is saving lives.
Yeah.
That's first things first. And secondly, there should be more awareness and orientation about the health insurance scheme. But
Mr. Remebaz, it's funny how the NHIS is centered on some certain people like civil servants, people working, because the common masses don't get access to this healthcare system and insurance. So where does that leave us? Because I know of my uncle apparently that works with a private airline, and he has an insurance covered for all his family members. And when we're growing up as kids, and if we had any condition, we just ran straight to the hospital and we just show them our family card. But I'm concerned about those people that can't get this access.
Yeah.
So where?
Responding to that, I think that's where the whole primary healthcare system comes in, because the major objective for the primary healthcare is for affordable healthcare services to the masses.
But how affordable is it to everybody?
Well, that's a problem, and that's why we're trying to proffer solutions. You get,
Okay, if I may add to that, to actually get a good health facility, all hands must be on deck. Now, the government must be there, the private sector must be there, the Christian body, the Muslim body, all the religious sector must be there to get this done. Because in your only two way, you can do something.
Yeah.
So I wouldn't want to actually lay this whole burden on the government alone, but the missionary, because before colonization, missionary actually did a lot of things here in our education, in our health as well. So we shouldn't neglect the aspect of the religious houses. We shouldn't neglect the private sectors. So those who can actually do something to save life should do as fast as possible. Got life first.
So are we advising youth who want to be medical doctors or the ones who are already reading medicine
or in the medical line.
Yeah, or in the medical line, to actually stay and try to do their part. Because I think if we do this, it will also help us to move forward.
And to answer that, Andrea, I think for me first, if you ask me, even though you haven't asked me yet, I think
I'm asking you now.
To me, I feel it has to start with the allocation, the federal allocation to the medical center, that's to the health system, because the allocation to the health system is so abysmal. It's nothing to write home about compared to Senna climes to other part of the world where you see there's much attention to the healthcare system. So to me, first of all, if you ask me, I feel that is one place we should hold our leaders accountable. Yeah, the healthcare system.
I believe you on that, because sometimes allocation is given. Yeah. But the people who are meant to handle this, to say, okay, this goes to this goes to that, they tend to misappropriate the funds.
Because they don't access healthcare in Nigeria.
Strike, because where is the money that was given to us?
Because they don't access healthcare in Nigeria.
Good.
The medical tourism, as Mr. Ifeanyi mentioned.
Yeah, they go abroad for their medical tourism. Exactly. Awesome. This is very deep and intense topic, and
we know if you finish them. Long. The matter long past River Nile.
However, it's our country. We have to fix it.
Exactly. We have to fix it. So if you know you're in a place to do something, please do your part. Play your part, and let's move forward. The change begins with you. It actually begins with you. It's not just the sentence. Not just by saying it. It actually begins with you and me. Of course, Reme. As Reme added, and me. We're in this together. Because if one person dies out of the failed medical system, we all die.
Sure. It's a collective effort.
It's a collective effort. So thank you so much for listening to this podcast episode. Zachary.
As I told you, dear listener, I told you it's always an insightful episode on the podcast. It's always informative, educative, and always entertaining, because trust me, there's always some sort of comic relief in between. Today we talked about the poor healthcare and infrastructure in Nigeria. And the topic not the finish. We'll go talk and reach tomorrow. It was nice investing your time today with us on the Advocacy Podcast. Remember, the Advocacy Podcast is highly brought to you by Street Project Foundation and Enugu Youth Entrepreneurship Network, EYEN, highly supported by Voice Global.
Thank you all for joining us. See you next time. Bye.
Speak up, don't you shut up. He's an articulate brand for a new Nigeria. Brother, speak up, don't you shut up. He's an articulate brand for a new Nigeria. Cause I'm an advocate for real. I say advocate, I sign. Advocate for life until the day I be no more. Oh, advocate for you. Advocate, I stand. Advocate for life until the day I be no more. You get a voice, you're supposed to speak, cause the matter for ground, yeah. I'm gonna say you the dream, so you're not fit to change Nigeria. But little drops of water makes the notion. Speak up, don't you shut up. It's an articulate brand for a new Nigeria. Speak up, don't you shut up. It's an articulate brand for a new Nigeria. Cause I'm an advocate for real. As an advocate I stand. Advocate for life until the day I be no more. Advocate for real. Advocate I stand. Advocate for life until the day I be no more.
Articulate, when we make noise, they try to choke us, but we raise our voices. So shout it out for a new Nigeria. Soro soke louder and win this together. Plenty kata kata, I go tremendous suffer. But I know there is now, we go rest together. Sit it on the throne, it's a motherland. You can never hold us back, and we never stand down.
can soon come. Youth profiling, gender-based violence.
Religious wahala.
He must change.
Tribalism.
He must change.
Insecurity.
He must change. He must change. He must change.
Corrupt system.
He must change.
Bad education.
He must change.
He
He must change. He must change. He must change. Not too sure. It's an articulate brand for a new Nigeria. Brother, speak up, speak up, speak up. Don't you shut up. It's an articulate brand for a new Nigeria. Cause I'm an advocate for life.